Morning. Good morning, Jeffette. Hey, thank you for putting your camera on. You know what? That's gonna benefit you today. Nice to see you, Yotson. Thank you.
Unmute, Miss Ellis.
Oh, I'm not. Now can you hear me? Now can you hear me?
Yeah.
Okay, good. Good morning, everyone.
Good morning.
Good morning. Happy Tuesday. So was the first day horrible and hard to do?
No,
Not too bad?
not too bad.
Not too bad.
Still enjoy.
Hey, yeah. Good morning, Ariel.
Good morning.
Good morning. Where are you?
Right now I'm in Mexico.
Okay, cool. Nice to see you. I'm Mrs. Ellis.
Hey,
Good to see you guys. I'm just waiting for people to show up here. Looks like we almost have everyone. So Emily, are you here somewhere? Don't see you yet. Good deal. We'll just hang on here a minute. What time zone are you in, Ariel?
right now it's like 10:32.
Oh, okay.
Yeah.
Yeah. Somebody asked me that yesterday, what time zone I thought you were in, and I go, I have no idea. So, okay, well, I think we'll start since it is time to start, and just want to say welcome. And so my chat line is open today. I had an update that I hadn't run on Canvas, and so that's why it didn't work yesterday. Couple things I just want to show you. One, this is how I take roll. So this is how I know if you're here today. Uriel can't turn his mic on. That's okay. You can use my chat line, Uriel. So see this green line right here, guys? This green line is what I call a classroom assignment. So if we're going to watch a video today, and if I ask you to write something in the chat or to come up with a question, then this equals points each week. So I just wanted you to see it, because when you put something in the chat that it relates to what we're doing, I just give you a hashtag, and then at the end of the week, I add points. And the reason is what I talked about yesterday, is that very much like being a nurse or a physician, I am a nurse, we're kind of in a partnership, not kind of, we are in a partnership to make you smarter. And so that is one of the ways that I know that I can help you gain points just by being present. Does that make sense? So
Yeah.
just know that's going to show up regularly. Okay. So let me see if I can share something that I wanted to show you yesterday. Can you see that?
Yes.
Okay, Kenneth and everybody else, have a real good look at this, because I'm going to, this is just the options that are available inside the Health Careers program. So if you look at us right here, so this is the very first class we offer. And it has one design, and the design is to teach you how to be a health science student. So, I know I always have students in this class. I have a student that was in this class 8 years ago, and she is a medical student finishing at Oregon Health Sciences in Portland. And she's bilingual in Spanish. And when she got in the course, she was like, there's no way, I don't have any doctors in my family. There's no way I can do this. And today she's a med student. So I just wanted you to sort of see a visual. So this would be, you know, and it doesn't matter what grade you're in here, because you can, well, however long you're in high school, you can take more classes. So next year, so say you're a sophomore here, next year you can take Health Careers 1 with Miss Jacobs. And this class is all about career exploration. Like I told you, I worked in a trauma hospital. And do any of you know what that is? Like what trauma hospitals do?
I don't know what that is.
A trauma hospital, trauma is when a patient is accidentally hurt badly and needs surgery. So for instance, we had a patient that fell off a 3-story building onto a concrete walkway. So multiple body fractures, a head injury, the patient needed blood. And so that's what trauma hospitals do. And so Health Careers 1, Miss Jacobs has a lot of speakers. Like she'll have nurses and physicians and all kinds of people that will help explain to you what's going on. So, and then anatomy and phys will just be a bigger and more detailed class of what we're going to do this year, except for Dr. Romanek doesn't talk about careers. So he will mostly just be teaching science. And then if you stay with us and you take the senior part of the class, look at the options available for seniors. So, and this, by the way, guys, doesn't cost anything. So maybe you have to buy a pair of scrubs. You can become a nurse assistant. You can become an EKG tech. These are the people that measure heart rhythms. You can get a technician's license to work in a pharmacy or get an emergency license to help with that kind of care. So I just kind of wanted you to see the big picture. We also have different clubs that meet for all kinds of students generally. They're not meeting this year, but they will meet next year. A dental club, a pre-med club, and then a club called HOSA, which is a national organization for students in health science programs like this. So does that make sense? Question in the chat if you have it. Otherwise, I'm going to move on. Okay, good. There's a questions chat there. Eugene, is it when they're trying to help people walk again in trauma hospital? Yeah, they have a you're talking about physical medicine. So physical therapists and occupational therapists work with patients, teaching them to walk again. But a person who's been in a big trauma will often need that. So yes, you are correct that a person that has been in a big accident will often have to regain a lot of skills that they're losing. Okay, let me see if I can also screen share what we're doing today. Yeah, exactly, Eugene. So if they were in a coma for a long time, you know, if you're in a coma for a long time, and for your age group, all of you, the most common reason for a patient to be in a coma, meaning deeply unconscious, is if a car accident. So not wearing a seatbelt, and you know, this part of your brain, the front part of your brain right here, is what keeps you awake. And if that hits a windshield, a patient your brain can swell and the patient will become unconscious for a long period of time. So absolutely, those are all excellent comments. Okay, let's screen share today and see if we can make that work. 1 second. Okay, so I think one thing I want to say at this point, and so, and I hope it doesn't sound weird, is this. You are going to see graphic images in this class. So remember, I'm a trauma nurse, and remember that I personally dislike being bored. So you're going to see things that show you what I'm talking about. And I have an image, it probably won't play, maybe it'll come up, but we really struggle getting our graphic images to come up on Canvas because of district filters. So I've had to go in and make this okay for you to see. But just know this, guys. A lot of times students will, especially in this class, will be like, Miss Ellis, you know, blood makes me sick. And so I know that I can't be a doctor, a nurse, a physical therapist, I can't, or a CNA, I can't do any of these things. And here's what I want to say. At the beginning, it makes everyone sick. So I once fainted in an operating room on top of the patient. Do you think I was embarrassed? Oh my gosh, I was so embarrassed. I was 21 and I was a third-year nursing student, and I was so humiliated, I didn't want to go back in the hospital. But my instructor told me exactly what I'm telling you, is that your brain will get used to the fact that this is your work. So people that work in operating rooms, and we're going to look at a video of an operating room today, they are not nervous anymore. So when we get a brand new nurse or doc or anesthesiologist, they'll often be nervous, and we can kind of tell who they are because they're nervous. But I tell brand new people in the OR in trauma situations, in a few weeks, this will feel like you're in your own kitchen. Like you'll be that comfortable with it. You'll know where things are, you know how things play out, and so you won't. So number 2 on our list today is, why are we starting with a unit that talks about directions on the human body? And the reason is accuracy. We want to make sure that everyone that works in healthcare knows which is right and which is left on a patient. And I know that sounds easy, but it's not always. What is the front? What is the back? What do we call the side? And we're all using common language so that there are no mistakes. So that's why we start with this, even before we start with cells, because even when we study cells, I'm going to be showing you pictures of what happens when cells don't work correctly. And when we study muscles, I'm going to show you some pictures of muscle disease. And when we do bones, I'm going to show you some fractures or broken bones. So any questions about the reason? So let's just look at this image, not for shock and awe. Maybe it won't open, but maybe it will. See if it'll let me open it. Of course it won't. We might just have to wait for a sec here. I think yesterday I'm just naturally kind of impatient with technology. Yeah, there we go. Can you see it?
Yes.
Okay, so guys, this is a patient that fractured or broke their ankle very traumatically in a bike accident. And so by the time we're done today, you're going to know kind of how to locate that and what we would write in a patient chart. So this patient has what's called had an external fixation. So that means they did, in some cases, when a bone is broken, we can just put a cast on and we don't have to do an incision. And so this patient had to have a repair of the bone that involved having a big incision. And those black things, I'm sure some of you have had sutures. Those black things on this side of this patient's leg are called sutures, and they're extremely sturdy. So this patient is now in physical therapy, learning how to walk again after a surgical event. And so I want you to get used to seeing good pictures. This is an excellent picture of a repaired fracture. And above all, I do not want you to be bored. So it's one of my pet peeves. I hate being bored and I don't want you to be bored. So let's go back here. Okay. Okay, so having looked at that picture, I'm going to give you a clinical assignment. And so I have a question up here. What are good clinical questions? And so here's what I want to say about working in the health sciences and being in health careers. And I say this to students sometimes, and it takes a while to learn this, but essentially, if you're a health science student, you don't get to be what I call furniture. Okay. If you're in an operating room and you're a student, you don't get to be a furniture, meaning you can't just kind of be an object. You have to have your eyes open and observing. So all during health careers 1, anatomy, when you have Miss Polizic and Mr. Bea, when we have speakers come, like last year we had a speaker come who was a pediatrician, and he brought a 3-year-old to class and said, let's just make some observations. And of course, the 3-year-old had a book and a ball and a stuffed animal and things that he was playing with. And we were just asking the students to observe the patient. So we're going to watch a video. And we're going to watch a video in an operating room of something called surgical timeout. So surgical timeouts happen every single time a surgery is done in the United States. So today at St. Vincent's, there will be hospital, which is very close to our school. There will be 50 surgeries. And before the surgery starts, there is a timeout for accuracy, meaning they're going to stop what they're doing and you're going to hear everyone participate. They're going to talk about location of what they're doing. And you'll hear them talk about kind of some other details, drugs they're giving, does the patient need blood, blah, blah, blah. But here's your clinical assignment for today to put in the chat, and I'll give you a few minutes after we watch this. I want you to observe one direction. You don't have to put that in the chat. And I want you to think of a question. You guys, the question can be anything. It can be, what's that thing on the wall? Or when she asked about this, you have to give me enough detail that I can answer the question. But I want you to just practice being observant for a few minutes. Okay, questions about that? Okay, I'm going to stop that screen share and we're going to watch this video. It's just about 5 minutes. Yes. It's not there at this moment. Hold on. It's not what I wanted to do. Hang on. Now can you see it?
Yes.
Okay, we have to give it a chance to load. That was yesterday's problem. And the other thing, I don't know if you guys experience this in other classes, but district teachers' computers are about 6 years old or 7 years old. That's really old in the computer world. And we are asking these computers to act like brand new MacBooks. And so I have a brand new MacBook that I use for other things, but I'm not allowed to use it in class. And so when we get a dark screen like this, it means that my laptop is trying to catch up with how fast I would like to go. So let's see if we can play it.
Site surgery, an error in the operating room again.
This most recent incident of wrong site surgery shows there's still work to be done, and 3 instances where blood was drained from the wrong side of a patient's
For
head.
some reason, the surgical checklist in every operating room didn't prevent the mistake on Jesse, even though the hospital says the doctor drew a circle around his right
The
eye.
purpose of the timeout is to ensure patient safety and prevent wrong side surgery. All activity in the operating room comes to a stop before the first incision when the surgeon, demanding everyone's undivided attention, announces the timeout is about to begin.
Let's do the timeout
All
now.
the team members participate in the timeout and share information they collected during their pre-procedure interviews with the patient. You will see our nurse, anesthesiologist, and surgeon interviewing the patient, Mr. Peter Simpson, and verifying his identity and that he is about to undergo knee replacement surgery on his right knee. They will bring this information into the operating room and together, during the timeout, confirm the correct patient is having the correct procedure on the correct site and side.
My name is Sheila. I'll be your nurse for today. What's your name
Peter Simpson.
and your date of birth?
Here's the nurse confirming the patient's identity, and the anesthesiologist does the same.
Hi, Mr. Simpson. My name is Dr. Nalin. I'll be your anesthesiologist today. Thank you. All right. I just have to ask you your name and your date of birth again, just like before. So can you tell me that, please?
Sure. I'm Peter Simpson.
After the anesthesiologist confirms the patient's identity, the surgeon does the same.
Simpson, how are you today?
Okay, Doc. I'm just a little anxious, you know.
Now, I know we know each other for a long time, but I need to check your name and date of birth on your ID band, okay?
Okay.
Great. So what's your name
Peter Simpson,
and what's your date of birth?
March 26th.
Each team member will be armed with the information they collected individually to make certain there's no discrepancy. All 3 members of the team have collected identical information, and they'll continue to do that during the process preparing for timeout to bring this information with them into the operating room.
Everyone, Sheila, well, okay. So let's do the timeout now.
Okay, then we're ready.
So this is Peter Simpson, date of birth, March 26, 1950. He's gonna have a right knee replacement. Okay, Sheila, what's the patient's name, date of birth?
Patient's name is Peter Simpson. His date of birth, March 26, 1950.
And what's the planned procedure on the side and the side?
He's gonna
To
have
standardize the process and reduce the chance of errors, the surgeon reads questions from the timeout script for the RN, the anesthesiologist, and himself exactly word for word as they're written on the script.
Great. Dr. Evan, describe the plan for airway management and anesthesia.
For airway management, we're going to be doing under general with intubation.
And any units of blood required for the surgery?
No blood required.
Any need for prophylactic antibiotics?
We're going to be given 1 gram of ANSA.
Great. And describe the patient's identification, date, and right or left orientation and x-rays. We reviewed that together.
We reviewed that.
Are beta blockers required during the procedure?
No beta blockers.
Great. Timeout is done. Go out and scrub. Okay, let's do the confirmatory timeout. This is Mr. Peter Simpson. He was born in March 26, 1950. And we're gonna do a right knee replacement. Sheila?
Yes. Peter Simpson, date of birth, March 26, 1950. And he's going to be having right knee replacement done.
Dr. Nevin?
Peter Simpson, March 26, 1950, right knee replacement.
Great, let's begin.
Before we move the drapes, let's do the sign out. Dr. Atala, what procedure was performed?
Perform the right knee replacement.
Any critical events or equipment problems?
No.
Sheila, now the instrument, the sponge, the sharp count,
Yes,
was it correct?
yes.
Now, Dr. Naveen, what is your recovery, your management plan at this point?
We're taking him over to the PACU.
Sign.
Hello, Jen.
Hey. The follow surgery was a success. Everything went fine. We expect to see some. Here's Jen.
Jen, thank you. I'm so glad you're here.
Let's be. How you feeling?
A little dry mouth, but I'm okay. I'm glad it's over.
How was it?
I was anxious, a little nervous, but the doctors and the nurses here, they were so good. They made me feel safe. I'm
Good.
glad. I'm happy we had the procedure done.
You look good.
Thank you.
Let's start there. Why am I still having this? I don't want it. Very weird. Okay. So guys,
Hey guys, welcome back to another Surgical Tech Tips.
I don't know why
This weekend I'm on call again, and I really wanted to shoot a video, and I just have a small case this morning.
Here we go. All right. So now, really easy to see in that, you know, just number one, what it's really like in an OR. That is so classically operating room. So again, those of you that came in late, I'm showing you my clinical grade sheet for the week. Here's my roll for our 4 days. And then I have a green line. And the green line is my student present physically, and are they present mentally? So the way that I know that you're present is that you participate in classroom assignment. And so classroom assignment right now is this. In our chat line, ask a question. There was a ton of stuff to observe there. I actually am going to give you 3 minutes to do that. So exactly at 1 after 9, we're going to read some of the questions. I won't read them all, but I want you to get in the professional pattern of looking at something and not being like what I do after I have watched too much TV, which is, you know, kind of zone away and be like, oh yeah, I've seen this a million times. We have to help our brains, our frontal lobes pay attention. So go ahead and do that. I already see a couple pictures, a couple questions in chat. Still got a couple minutes if you want to put a question in. Awesome questions. Okay, I think I'm going to start answering some of these. So Parsa, it's an excellent question. What is that medical checklist? We have a checklist in the operating room that helps us not make mistakes. And so it's the documentation, it's the patient's chart. And so, for instance, let me give you a great example. 1 million people will ask a patient in the operating room, have you had breakfast? Like right before a surgery. So like the admitting people will, the first nurse that sees them, another nurse, and the patient's like, why is everyone asking me? And the reason is that if you eat breakfast before you have a big anesthetic, you can, it'll make you vomit during surgery and you'll inhale it into your lungs and it'll kill you. So this checklist is how many times has the patient been asked these kinds of safety questions, okay? How long, Eugene, does a right knee replacement take? Depends on who's doing it, but about 2 hours. And so when you're in anatomy next year, Dr. Romanek will show you an entire knee replacement surgery. You'll be able to see that. Guadalupe, why do they have to remember the birth date? Because that's how you are identified in the hospital, not by your name. So if we have 2 people with the same birth date, then we'll verify, but we ask patients first before we ask their name, if we're trying to find them in our system, what's your birthday? Great question. And we also want accuracy on how old our patients are. Kenneth, what if the doc makes a mistake? You know, accidentally, the doctor is required to repair it. And yes, Guadalupe, they can get sued. So in the United States, if you don't like what your doctor did, you can sue them, but it's very expensive to sue someone. So you have to have really good cause that you know something has gone wrong. So that actually sounds like a bad thing about our system, but I think it's a really good thing about our system is that our doctors go to school about 15 years after high school before they can work on people's knees. And so they should be pretty good, right? Practice makes perfect. And that's a very long journey to becoming a bone surgeon. Emily's asking, if you're a minor, if you're under 18, who will sign a surgical performance safety paper? So, a consent, a surgical consent. If you're under that age, yes, your parents or guardians have to sign. If you don't have a guardian, the hospital will assign you a guardian, and it's usually a physician. I love Dave. Is it Davis? How many people are allowed maximum in an operating room? I have been in an operating room with 18 or 20 people. And normally I'm going to say it's about 5 people. But if we have a patient like the one who fell off the building and they need numerous different kinds of surgeons, a bone surgeon, a head surgeon, eye surgeon, plastic surgeon, then the more they bring all their little helpers and all their tools. And we also might have someone in there taking x-rays. And so we might have a pharmacist in the room. So we don't like to have that many in there, to be honest, because I think you saw in the video, they're trying to minimize distraction, and you have to be able to kind of do what we're doing, practicing, which is watching and concentrating, okay? I think I asked that question, Uriel, about what would happen. Was the extra guy observing? He wasn't asked to repeat anything. I think he was an assistant to the anesthesiologist, the sleep doctor. Good question. Amazing observation. I don't think most people saw that guy. And then how many people work on a surgery? It depends on how big the surgery is. So You can have a surgeon and typically a nurse who's handing instruments only, and then one other nurse and a sleep doctor in the room. That's 4 people. But as I said, depending on how big the surgeries are. Wait, you almost have the same question with me. What if they make a mistake? I talked about that. They're responsible to repair the mistake. That's why we keep people in the hospital. And so after you have surgery, say your knee or ankle got repaired today. The doctor's job after he gets done in the operating room is to come wherever you're recovering and do an examination to know whether or not you're looking like they like you to look after surgery. Oh, there's an awesome question. Luz, what if the anesthesiologist added anesthesia to the patient? How do they estimate the amount of anesthesia? Such a great question. And I used to, when I was your age, I used to sit in chemistry class sometimes and I'd be like, when am I ever going to use this? Like, I'm so like, I don't get it. Well, anesthesiologists know a lot about chemistry and they estimate by weight. That's exactly right, Eugene, and age. So if you're you, so if it's Uriel and they're going to give surgery to him, I don't know how old you are, Uriel, 17, 16. So his metabolic rate, the rate at which he'll use the drug is different than for me. So by age and weight is exactly the right answer. So awesome, awesome questions. I won't always be able to answer them all, but this is exactly what you would do as a professional student. If your instructor in a professional school, yeah, exactly, Kenneth, you're 175 and 16, but in a professional school setting, when your professor says, do you have a question? No is really never the answer. They expect you to have a good clinical question. So that was awesome. I really, really thought you did a great job on that. And I'll look back to see who asked questions so I can record that. Okay, so on to the real subject of the day. We're probably not going to quite get through it. Is a short video, also I think about, I don't know, 8 minutes. And you have an assignment that I want you to be working on that's linked right here. And I want you to do page 1 of that before Thursday. So that's your study guide for our test. We're also having a quiz next Wednesday on pages 1 through 3. And I haven't even logged it into our assignment yet. But it's a tiny little, I don't know, 9-question quiz, but just to keep our brains learning vocabulary. So right now we're going to watch one of my favorite biology channels, just talk about why do we care? Because remember yesterday I said, one of the things I do is avoid giving stuff busy work. I am not interested. And I know you're not interested. So let's watch this video about the why do we care in medicine about anatomic terms.
Should we take notes?
Before we take a look at the meaning of specific anatomical terms, I suppose the first question we should answer is, why do we use anatomical terms? Well, anatomical terms exist so that we can precisely describe the location of features on a body. Let's imagine the following scenario. Here is a female. She's upset, and it's not just because she's naked on YouTube. It's mostly because she's just discovered a rather large pimple on her stomach. But where exactly on her stomach is it? Statements like "there's something on my stomach" are so vague and non-specific that they don't really mean anything to an anatomist. Is the pimple here, or here, or here? But if we use correct anatomical terminology, it's possible to precisely identify the location of her pimple or any other body feature so that anyone can precisely locate it. For example, if we're told that her pimple is 2 centimetres superior to her navel or belly button, then its location becomes obvious to everybody, which is probably not what this female wants. Before we move on from this picture, take a good look at how the woman's body is positioned in this drawing. Note how she's standing upright, arms at sides, palms facing forwards, and feet together. We call this the anatomical position, and it's the international standard position in which structures of the human body are described. Whenever you use anatomical terms, always apply them to a person standing in the anatomical position. Never apply them to, say, a person sitting on the ground or upside down or bent over sick after a heavy night out. Okay, let's look at some anatomical terms. The first terms that we're going to define are the terms left and right. Now, I know what some of you are thinking. Didn't we learn this in preschool? Well, even though you might think that the definitions of left and right are straightforward, many students actually use these terms incorrectly. You see, when we use the terms left and right, we're referring to the left and right sides of the person standing in the anatomical position, which in this case is the woman in this drawing. We are not referring to the left and right sides of the observer, which in this case would be you looking at this drawing. Consequently, for the woman in this picture, this is her left side and this is her right side. So if you are asked in a test to describe the position of, say, point A relative to the umbilicus or belly button, the correct answer would be point A is to the left of the umbilicus. Okay, next are the anatomical terms anterior and posterior. Anterior means front of the body, whilst posterior means back of the body. In humans, you can also use the term ventral for anterior and dorsal for posterior. Here are 2 examples of how you might use the terms anterior and posterior in a sentence. Example 1, the navel or belly button is on the anterior or ventral surface of the body. Example 2, the heel is posterior or dorsal to the toes. Next are the terms superior and inferior. Superior means above or towards the head. Inferior means below or towards the feet. For example, on this drawing, point A is superior to point B. However, point C is inferior to point B. Next are 2 anatomical terms that you probably haven't heard before. They are proximal and distal. These terms are only used to describe the location of 2 points on the same limb, which could be either an arm or a leg. Proximal means closer to where the arm or leg inserts into the body. Distal means further away from where the arm or leg inserts into the body. On this arm and leg, red arrows indicate proximal, whilst green arrows indicate distal. We can use the terms proximal and distal in the following ways. On the leg, the knee is proximal to the ankle because the knee is closer to where the leg inserts into the body. But on the arm, the wrist is distal to the elbow because the wrist is further away from where the arm inserts into the body. Remember, only use the terms proximal and distal when referring to 2 points on the same limb. If a point is no longer on the limb, like point A in this drawing, then you can't use the term proximal anymore. Instead, point A would be superior to point B. Next are the terms medial and lateral. Medial means any point closer to the midline of the body. The midline is an imaginary line that cuts the body in half vertically. Lateral means any point away from the midline. For example, in this drawing, point A on the leg is medial to point B because point A is closer to the midline. Alternatively, you could say that point B is lateral to point A because point B is further away from the midline. Another example would be your thumb being lateral to your little finger on your hand. Okay, now that you've mastered the basics, try to answer the following question. Using correct anatomical terminology, can you describe the position of the nose relative to the eyes? I'll give you 5 seconds to work it out. Hopefully you answered the nose is medial, inferior and anterior to the eyes. So far, all of the anatomical terms that we've described are what we call directional terms. That is, they're terms that describe the position of one external structure relative to another. But what happens if we want to observe the relative locations and arrangements of internal structures and organs, like, for example, the heart, lungs, and brain? Well, to do this, we need to cut the body into slices called sections or planes. The 4 anatomical planes are sagittal, frontal, transverse, and oblique. A sagittal plane is a lengthwise or vertical cut that divides the body into left and right portions. If the cut passes through the midline of the body, then we call this a mid-sagittal plane. However, if the cut doesn't exactly pass through the midline, we call this a parasagittal plane. Next is the frontal plane. This plane divides a body into anterior and posterior portions. For example, a frontal section of the head would divide it into the face part and the back of the head part. Next, we have the transverse plane. This is a horizontal cut that divides the body into superior and inferior portions. Finally, there is an oblique plane, which passes through the body at, you guessed it, an oblique angle. The importance of understanding planes becomes obvious when you look at these 3 drawings of the brain cut in sagittal, frontal, and transverse section. Note how different each brain section appears, and how some features, like for example the pons, are easy to see in one section but difficult to observe in others. Thanks for watching. Subscribe to my YouTube channel and stay tuned for more Human Biology Explained videos.
All right. Hold on. Let me get rid of that guy. Okay, so that's essentially an overwhelming look at our entire unit. So the next 2.5 weeks. And so one thing that you will learn about me is that I like to chunk things up and take them a little at a time and kind of get rid of anxiety. So I'm actually going to plug in my whiteboard and I'm going to help you with your assignment. So if you want to open up your Chromebook Language of Medicine assignment to page 1 and work along with me on the board, that will really help you right now. The other thing that I said yesterday I want you to do is to keep a vocabulary list of your own for every single unit that we do. And the reason is, in your own writing, so the more senses we use, if I'm just listening to something, I don't learn it as well as if I'm actually using a pen. And some of you, it's your visual, you like a picture. So I have really horrible, my own art to show you today. That'll be really sad for you, but it is part of being a healthcare student, is enduring my art. So I'm going to plug in my webcam actually right now, and then I'm going to let you look at my whiteboard. See.
see your whiteboard.
See me?
Yeah.
Yeah, so students ask me every time, like, where are you, Miss Ellis, in your house? And like, I'm upstairs, just a second, I'll show you something. My dog likes to sit across from me in a chair, and he's snoring right now. So just know, like, I'm a real person. We'll put him back on his chair.
I like your dog. He looks like,
normal. Yeah, yeah. He's he's spoiled. Can I say that? He last week when I was teaching in the advanced classes, I shut the door because he was snoring so loud I didn't want him in here. And then he was scratching under the door and putting his paws under the door. So I just have decided it's better, but he might bother us from time to time. So can you all see my board?
Yeah.
Yeah, cool. Here's the first thing I want you to do is I want you to record the words I'll always have the vocabulary of the day right here. And this is it. We've already done those two, but I'll go over them. So essentially there's 1, 2, 3, 4 terms that are new today that I'm going to teach. Normally, guys, you will have your books as a resource, but in this first language unit, you only have me. Of course, I know you can Google your brains out and find out whatever you want to know. But I want you to just write these terms to make sure that you get the important ones that I want you to have carrying forward. And of course, they're new right now. So when I was first a nursing student and taking science classes in high school, I was like, there's no way my brain is going to hold on to these. Trust me. Every health careers teacher will use these terms, and you will be so good at it by 6 months from now that you won't even think about it anymore. And hopefully you can tutor another intro student in years ahead, because that's something I really love our older students to do, is to help somebody who's younger. Okay, so I'm just going to give you a minute to write your words. These go on your vocabulary sheet in your health careers binder that I know you've already set up. That's always helpful, because then when it's time to study for a test, you have all your stuff in one place. I really am going to give you 3 minutes. Somebody's going to have to give me a heads up when you're done. And I'm going to look at my chat line too.
done.
Done. Thank you, Eugene. Okay, so let's just remember what these words mean. And I never intend to kind of blow by you with information. And because I worked in a trauma hospital, I can talk fast. And so I also grew up in a household where my parents spoke Spanish, and I don't speak Spanish really. And the reason was I told my mother I wanted to learn French. This is one of the things I regret most of my childhood, was that I had an opportunity to do it and I didn't. But I do know how to say slow down in Spanish, because my parents would take off without me. You know, they'd be talking, or when I go to Mexico and I speak, you know, I order a hamburger, like in a restaurant, sometimes in Spanish, sometimes they think I actually can really speak Spanish and they just go. And I'm like, Más despacio, por favor. So I can't get it. So if I go too fast, all you have to do is put in the chat, too fast, Miss Ellis. And I don't care what language you speak. If I'm talking too fast or I'm leaving you behind. So to review yesterday, anatomy, you could go ahead and write on your vocab, what does this word mean? It means parts, the parts of the human body. That's it. If you're studying anatomy, you're studying parts. From the tiny, 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 tiniest little cells or chromosome fragments to the liver, which weighs, your liver weighs, I don't know, 5 pounds. That's a big organ. It's like a big roast piece of meat. It's big. And it has about 3 units of blood in it. It's huge. So the parts. Physiology, anytime you see this part, ology, it means the study of something or the science of function. So yeah, we know you have a liver object. It's an object, but what does it do? Your liver makes everything from the coating to on your nerves, to all your hormones or lots of them, to regulate your blood sugar. It also allows your blood to clot. So if you cut yourself when you eventually stop bleeding, that's your liver making clotting factors. So this is all about how does it work? Okay, good. That's just review. So these 4 words, this is my human. I'm sorry, he does not look normal, but it's the best I could do. I'm not a really great artist. But anatomic position is probably the place to start, and that is referring to a position that we put patients in, which is facing forward with their palms out. Can you see my palms? And so see how his thumbs, I just made his thumbs a little bit roundy so you could see them. The patient is like this. So this surface is the front. This is in medicine, this is the front of the arm, the palm side. So anatomic position is simply a position that we put patients in for accuracy. So I know that your assignment, your 1-page assignment for Thursday says, in your own words, would you please define it? So tell me this, tell me in your own words, it's a position that we put patients in for accuracy. The patient is standing. The patient is face forward with their palms up. And I don't know if you guys noticed in the surgery video, probably not, that the nurse, one of the nurses in the room turned the patient's hands over. Just for consistency, just for accuracy, okay? And then when we're talking left and right, we are talking in anatomic terms, the patient's left and the patient's right. So when you're looking at me right now, this is this is the right side of your visual field, but it's the patient's left arm, correct? So this is the left side of a patient. This is the right side. If you need to make a stick figure and remind yourself of this, this is good. This is anatomic position. Also, guys, on my vocabulary list, I always star when I think I've talked about it. So sometime if I come to class and something's starred, you can be totally honest, say, Miss Ellis, I don't remember you talking about it. Because remember, we're partners, right? I don't know everything. I'm trying to teach you what I do know, okay? And I'm not perfect. So anatomic position. So which side of the body, of the human body, is the heart on? Some of you that haven't done any classroom points today could put that in the chat. What side of the body is the heart on? Yeah, yep.
Banana, right?
It's actually, in 1% of patients, it is on the right, but in 99.1% of patients, it's on the left side. It's right here. Actually, it's right down here. So left side. So I love that you said is it on the right? Rarely. But when we teach you in medicine, we're teaching you kind of like the statistical norm, like most people. Like, let me give you one that's current. Most of you, 90 of your age group, 99.96 of you will not die of COVID. Why? Statistically, it doesn't really kill young people. Okay? Statistically, hearts are on the left. But we can have errors. We can have errors in utero. We can have errors in babies in development in which the heart would show up over here. And usually there are other problems. When we do cardiology this spring, we'll do a couple weeks of cardiology. I'll talk about that. Okay, so left side, right side, patients left, patients right. I'm going to quiz you on this as we go along. So don't feel like, oh, I have to know that like instantly. It's just our way. So you notice during the surgery film, they're like, we're replacing the patient's right leg. And about 5 people in the room said, the right knee joint, we're replacing that joint. And then the surgeon took a surgical marker and marked on the patient's right leg. And that is not unusual. That will happen anytime there's a right or a left. Some doctor or nurse is writing on the patient's leg or that's going to be worked on. Why? We don't want to do the wrong one. And has that happened? Rarely, but yes, it has happened. Okay, we have like time to do one more and then I'm going to let you go. So anterior means the front. And what I want you guys to know is that is the term that I use. I will not use ventral very much. Ventral is used more in veterinary medicine. It's occasionally used in human medicine. Dr. Romanek will get into that later, but I like anterior. So if the patient, our patient who is having the right knee replacement, here's his right knee. The doctor wrote a check mark on the anterior, the front of the right knee. Okay, that's just how we describe the front of the human, is anterior, the anterior space. The nose is anterior to the eyes because the eyes are here and the nose sticks out in front of it. Makes sense? Okay, anterior, in front of. Good. Okay, you guys have done an awesome job of listening today. And so here's something else you need to know about me is I love the whiteboard and I love students to ask questions. So let's see. Left chest, I learned this thing in the Philippines about the circulatory system. Yeah, okay. So we're gonna do the circulatory system, but not for a couple of months. And actually the vascular or circular system circulatory is my favorite of any of them. So I'm gonna let you go. If you have a question you wanna put in the chat before I look through for participation today, go ahead and I'll save the question for tomorrow. But anyway, I just wanna say nice job. I'm gonna see you on Thursday. You will have page 1 done, right? Page 1 of the Language of Medicine packet. You should have done on Thursday. Okay.
Bye.
Bye guys. Bye Uriel. Enjoy the sunshine. It's gonna snow here, Uriel, tonight.
Yeah, I'm just gonna enjoy it for like 7 days.
Good. Bye,
Yeah.
Dotson. Bye, Emily. Bye,
Bye,
Kenneth.
have a good day.
See you guys later.
Thank you.
Have a great day. Eugene, Parsa, Kenneth, Uriel. Bye, Hala.